£1 last year and £4 million this year barely touch the sides for some airports, yet the Minister repeatedly assures us his government is helping the sector. When will the Minister step up and provide the real assurances that our aviation industry will be given the support that it needs?
The Honourable Lady is quite right to draw the House's attention to the importance of Manchester and Liverpool airports. And I visited Liverpool Airport not that long ago, so I've seen for myself. I understand how important it is for her area. She's also quite right to acknowledge, and I'm grateful to her for acknowledging that it was welcome, that the AGOS scheme is one that has been of assistance with fixed costs, particularly business rates, to airlines, to airports around the country. I think the most important thing that we all should be doing is looking to find a way to enable people to be able to get flying again, because that is the way in which we will be able to best support our airlines and airports, which are so important to all of our constituents for many different ways all across the country.
Mr. Speaker, I think the Minister is as confused as I am by the opposition's position. They spent many weeks criticising a non-existent delay on action with the Indian variant, and now they criticise prompt action on France. It's absolutely right that we make the most of our fantastic vaccine rollout to restore the freedoms we've had to sacrifice. Will you join with me in encouraging everyone who has not yet had the jab to get it, with whether they live in Thornley, Herworth or Newton Aycliffe or anywhere else in the UK, so that airports like Teesside can take off again?
My honourable friends, absolutely right. We do need to enable airports like Teesside to take off again, and what we are seeking to do is to lay in place a system that enables a robust, cautious and sustainable return to international travel in particular. He's of course absolutely right that the vaccination programme is a great national triumph, and I would encourage everybody to get their jab when it's open to them to be able to do so, because it will help protect them, their friends, their family, the people they work with, and it will also help, as he quite rightly points out, with travel as well.
Shannon.
Thank you, Mr. Speaker. Can I thank the Minister for his answer so far? I know that he wants to help and assist, and I know that's his purpose. I've been contacted by constituents who have loved ones who have died in Poland, having difficulty travelling. Those who want to travel from Morocco to visit elderly dying relatives, again having difficulty to travel. My staff spent 35 minutes on the phone on just one of those issues this morning. I'm not being critical, Minister, but it really is an issue. Also, given the fluidity of travel arrangements where tourists are already on holiday and restrictions change while they are there, will the Minister give allowances to those who were not expecting to quarantine on arrival back in the UK, as there have been reports of lack of medication and basic daily needs? Thank you.
I thank the honourable gentleman for his question. He's quite right that the government does wish to see travel restart, provided it's in a safe and sustainable way, and he draws attention to the reason for it. I mean, often people, it's not just about people going on holidays, important though that very much is because of the jobs that industry sustains, but also because people haven't seen relatives who may be ill, and that's important that we do that in a world that's in a globally connected country. So we will continue to do that in a safe, sustainable way. If there's anything I can do to assist any particular constituents, as he's mentioned, I hope you won't hesitate to contact me, and I'll see if there's anything I can do to assist.
Green.
Thank you, Mr. Speaker. It's unarguable that the effect of imposing quarantine on travellers to France will be significantly to reduce the numbers of those wanting to travel. With this in mind, will my honourable friend agree that the imposition of Operation Brock on the M20 in Kent, which is designed to cope with long queues at Dover or the tunnel, was a trifle premature, and that Operation Brock should therefore be removed as soon as is humanly possible?
I thank my right honourable friend for raising this question. I know it's something that matters a great deal to his constituents, and he's been a real leading voice in campaigning on this, and I recognise the disruption to his constituents. The Kent Resilience Forum have put in place that movable barrier between junctions 8 and 9 of the M20 this weekend. It enables Operation Block to be implemented. This is a precautionary decision by the KRF in advance of the summer holidays. I know that they will keep that decision under review and will deploy Operation Brock for as short a period as possible. I entirely recognise the strength of feeling on this matter, Mr. Speaker, and I know that my right honourable friend, the Minister for Kent, will be arranging a meeting between the KRF, my honourable friend, and other interested MPs as soon as possible.
Let's go to Mary Kelly-Foy. Mary.
Thank you, Mr. Speaker. I've had constituents attempting to return from abroad contact me in desperation because official government advice is to not take a PCR test if they've had COVID-19 within the last 90 days. Yet testing is a requirement both to return to the country and as part of the test and release scheme. Can the Minister offer some much needed clarity for my constituents in Durham and say how testing requirements for people returning to the UK apply to those who recently had a positive PCR test abroad?
The guidance with regards to testing is laid out on the government website, and of course I have to note there has been a change as of today, which is just worth bearing in mind. I'm happy to write to the Honourable Member to give her that precise clarity so that she can pass on that to her constituents and indeed to any others who may need to refer back to it.
John Morrissey.
Thank you, Mr. Speaker. I'm looking forward to my holiday in the English countryside this summer, and may I invite my SNP colleagues to join me in enjoying the beautiful English countryside. And for those that would like to journey abroad, will my right honourable friend provide greater clarification as to how his department will be examining the travel corridors and his further commitment to the aviation sector in the months to come?
Well, Mr. Speaker, the aviation sector is of vital importance to honourable members, right honourable members all across the House, for the connectivity it brings, for the employment that it brings, and of course for our place in the world. This government is committed to continuing to review the measures that we have in place and to building a restart of international travel that protects public health and is safe and is robust and is sustainable, but nonetheless does restart international travel. And to that end, not only do we review regularly the country allocation, there are also checkpoints at the end of July and then in October where we review the overall policy, and I of course commit to keeping that under review.
Sarah.
Thank you, Mr. Speaker. It feels a little like Groundhog Day. I stand before this minister and ask for sector-specific support for aviation, and he reels off figures which bear no relation to the reality of what aviation workers and the sector actually needs. Compared to other countries, the UK airports have had an absolute pittance from this government. Will there be specific support for aviation to get it through a second summer of reduced travel before it's too late?
I recognise how important this is to the honourable member for her constituency, for her constituents who are employed, and I recognise as well that this is a very difficult time for the sector. We have provided, and she recognises the fillers, but it's approximately £7 billion worth of support through the cross-economy schemes, as well as in particular the AGOS scheme that I've referred to earlier. We'll keep all of those things under review. What we are really trying to do here is to enable the sector to restart in a safe way, in a sustainable way that protects public health, because it's by doing that that we help Luton Airport and the airlines that operate from there and all her constituents.
Atwood.
Thank you, Mr. Speaker. Nearly 7 in 10 British adults have now received 2 doses of the vaccine. Does my honourable friend agree that we should use the long-term protections that these vaccines provide to restore some of the freedoms that we've lost over the past year, including being able to travel abroad?
My honourable friend is quite right, Mr. Speaker. The vaccine success has been a major national success story, and we are looking at ways in order to capitalise on that, to restore freedom and to restore the ability to travel. Of course, today's announcement, or rather the measures that come into effect today, are a major part of that. We will continue to examine ways in which we can take the next step, of course.
Dave Dugan.
Mr. Speaker, the Association of Independent Tour Operators say the changes to travel to France has squashed consumer confidence, and the SNP of course uphold the rule that public health must come first, but the continued tumult of international restrictions and rules will deny the travel sector a full recovery anytime soon. Businesses like Travel Your World in Forfar in my Angus constituency desperately need dedicated support. So will the Minister finally accept this and commit to new financial support for the travel sector for as long as this international chaos persists?
I'm grateful to the honourable member for having raised that point, and I recognise, of course, again, that these are challenging times for his constituents who work in the sector, and I'm grateful to him as well for acknowledging the fact that, of course, he supports the principle, the Scottish Government has supported the principle, and of course I think people would expect us always to protect public health, and I know he accepts that. As I've said to other honourable and right honourable members, what we are very keen to do is to make sure that we restart international travel in a way that is sustainable, that is robust and protects public health, because that is the way to assist his constituents in, and indeed all our constituents in the travel sector, wherever we are in the UK.
Yeah.
Thank you, Mr. Speaker, and I'm pleased that Teesside holidaymakers choosing to fly to amber list countries can do so from Teesside Airport once again. However, can I ask the Minister to reconsider the position of Dubai on the red list? The UAE have vaccinated around 82% of their population and is home to hundreds of thousands of British expats who just want to come home.
Well, Mr. Speaker, I pay tribute to Teesside Airport for the expansion in services there, which is a very good thing to see, and I hope to see very much more of it in the weeks and months ahead. My honourable friend will be pleased to know that we keep the categorisation of all countries under constant review. We're guided by the data that is provided and the advice that's given by the Joint Biosecurity Centre, which of course comes up for ministers to make the decision. So we will continue to review that at all times.
Let's go to Catherine McKinnell. Catherine.
Thank you. Thank you, Mr. Speaker. July and August are crucial months for airports, but the modest uplift in travel expected this year means that airports like Newcastle International will continue to face an extremely challenging financial outlook for some time. So can the Minister confirm when we will see a more targeted, comprehensive support package for this sector, as well as further help such as the harmonisation of quarantine rules for UK nationals vaccinated abroad and action to bring down the high cost of testing?
Mr. Speaker, the honourable member raises a number of points there. I'll do best to address them all quickly. She's spoken very compellingly in debates that I've been with her about the importance of Newcastle Airport to her constituents and to the jobs that are, of course, provided. With the cost of testing, we are continuing to take steps to see what we can do to reduce the cost of testing. She will have noticed, of course, that the cost of testing has been coming down over the course of over the course of recent weeks. And we also will continue to do anything we can to support the sector as we look forward to a successful restart.
Duncan Beckton.
Thank you, Mr. Speaker. I too woke on Saturday morning to lots of concerned residents who were upset about the change in self-isolation rules coming back from France. Can my right honourable friend reassure me with two particular questions? Why did the government move so quickly to change those rules? I think that message really needs to be key. And secondly, why was France singled out when the beta prevalence is seen in many European countries and it's seen by many to be quite low in France?
Yeah.
My honourable friend will, of course, makes, of course, an important point, and I am conscious that the Vaccine Minister is shortly to make a statement, and he may be able to assist further with those specific data points that my honourable friend raises. But he is absolutely right to raise the questions that he has. The reason for speed, as I know he will understand, is that, as we've always said, sometimes we do just have to act quickly in order to protect public health. Unfortunately, one of the things we've always found with this pandemic is that things do move quickly. Sometimes we have to take quick action. We've always said we will, and I think it's right that we do.
Let's go to Sammy Wilson. Sammy.
Thank you, Mr. Speaker. The restrictive list of green countries, the expensive and numerous tests, changeability of rules, severe quarantine arrangements, and refusal to give mutual recognition to vaccine certificates from other countries have discouraged UK citizens from travelling abroad and also stopped much of the inward-bound tourism which generates so much money for our own economy. Will the Minister consider increasing the list of green countries given the vaccination programmes in some of the countries which tourists would go to? And secondly, grant mutual recognition to vaccine certificates issued in other countries so that tourists can come from other countries to here?
Because those are two very important points. I would very much like to see more countries on the green list, but of course we do have to be guided by the advice that is sent by the Joint Biosecurity Centre. There's a number of different factors that are taken into account, which are listed on the website, and vaccination is one of them, prevalence is one of them, presence or otherwise of variants of concern is another. So it has to be data-led, as I know the Honourable Member will understand, but of course we'd like to see more on the green list as soon as that's possible. With regards to the mutual recognition of vaccines offered elsewhere, we've said that this is a phased restart. In allowing those who have been double vaccinated in this country to travel abroad and then to come back without having to self-isolate, that's a step. We're also looking to see what we can do to offer the same recognition to those from abroad. And I can't tell the Honourable Member any more at the moment, but I hope to be able to come back to the House in due course and to do so.
Let's go to Peter Bone.
Thank you, Mr. Speaker. And on Freedom Day, it is very good news that amber list countries you can now travel to without restriction. If you've double vaccinated, in fact, you can almost be treated as a green country. But you can only travel to these countries if the Foreign Office advice says they're safe to travel to. Could the excellent Minister confirm that the travel advice from the Foreign Office has changed, as well as the advice from the Transport Department?
My honourable friend puts his finger on a very important point, which is right to clarify. The advice that we in the Department for Transport give is around the risk of importing a variant or prevalence of the virus back into this country. The Foreign Office, when they give their travel advice, are dealing with the situation that exists in that other country. There's a number of other factors they have to take into account, such as political stability, for example, the state of a healthcare system in another country. There's a number of factors they have. So essentially they're looking at different things. We're dealing with the risk of incoming. They are dealing with the risk and the advice to be given to British citizens in that other country. And the Foreign Office will always have the ability to do that.
Mr. Speaker, as COVID cases in England go through the roof, 1,200 scientists backed a letter to the Lancet saying it's completely reckless for this government to lift all restrictions today. International experts are saying England, as an international travel hub, is now a risk to the rest of the world. The reality is his traffic light system is going to be meaningless as more countries like Bulgaria put the UK in the red list. So when is he going to when are they going to provide real support for the travel industry rather than continuing to cause chaos and uncertainty?
So, Mr. Speaker, I'm afraid I can't agree with the honourable gentleman. I simply don't agree that this is a system that does lead to uncertainty. It is a robust system. We've explained in detail how it's put together, and it does enable people, the industry and people and our constituents, to have an understanding of the system that exists. We'll obviously keep it under review, but I do think that when he looks at the systems that are in place across the world, our one is actually quite an advanced one.
Alex Shelbrooke.
Thank you, Mr. Speaker. Mr. Speaker, I listened carefully to my honourable friend, and he's absolutely right to put public health first. But he also has to recognise that public confidence in going abroad is now in a ditch. And the travel agent industry is on its knees now, and it's on its last knees. And so my honourable friend is responsible in a department for setting the amber countries, and he's made the decision on France. Now, if he can't say when that decision will come to an end and this is the country and it's going to stay like that, which I know he can't, could I urge him to follow up? I wrote to the Chancellor and I've written to the Secretary of State for Transport to say the travel agent industry needs, in fact, must have new grants applied to it because it cannot survive, Minister. It cannot survive. And it employs thousands of people. It produces a huge amount of taxation revenue for this country, but it will not survive. It needs that support, Minister.
Well, Mr. Speaker, I'm grateful to my honourable friend for having drawn the House's attention, and we'll all see it in our own constituency, the critical importance that the travel agency sector brings, the employment it brings, and the way it opens up the world to all of our constituents. We will, of course, continue to talk to that sector and to all of our colleagues across government in order to understand the way in which that sector may be best supported. But I do emphasise the point that I've made today, that it is by getting people travelling again in a way that commands public confidence, by protecting public health. That's the way in which we really will help all parts of the travel sector.
Dobby Perkins.
Thank you, Mr. Speaker. In April, the rate in Britain was very low. The rate in Southern Asia was very high, and yet there were no restrictions on people coming from Southern Asia, leading to the Johnson variant taking hold here. Now the rate in Britain is very high, but we're preventing people from travelling to other countries where the rate is much lower than here. And so there is this chaos and people being uncertain about what's happening. Simultaneously, we read in the Daily Telegraph and the Daily Mail that Conservative MPs are all turning the app off so that they don't get pinged, so they're able to go away on their holidays. Doesn't all of this just add to the sense that we have a government that isn't in control of it and has different rules for the people that they themselves are willing to follow?
No, Mr. Speaker.
Let's go to Andrew Percy. Andrew.
Thank you, Mr. Speaker. Travellers from the US and Canada, which have lower COVID rates than the UK, can now travel to Europe, but they can't travel to the UK. I've heard what the Minister had to say about recognition of vaccines. Can I urge him to move as quickly as possible on that? And is it not time now to stop talking about green or amber countries and to start talking about green or amber travellers?
My honourable friend puts his finger on a really important point, which is understanding the importance of vaccines and what that can tell us. There's a number of aspects in which the science, we need to fully understand the science, for example, on transmissibility of the vaccine if you're vaccinated, the effect on different variants, for example. We are working at a great speed, but doing the work diligently to make sure that we can take full advantage of the success of our vaccine rollout and protect public health at the same time.
25 withdrawn. We go to Nigel Mills. Nigel.
Thank you, Mr. Speaker. Can I ask the Minister if there's anything the government can do to help families where they have a young adult that's currently 17 but turns 18 during the holiday season because they can't be vaccinated? Even if they can't have both, and yet they can perhaps travel away, but they can't come back if they've turned 18 in the meantime. Is there any way we can relax the rule to perhaps apply it from September so families can have a holiday together?
So the rules as they apply are laid out in detail online, and all families can look at those and understand it. I'm very happy to consider that suggestion and any others that honourable and right honourable members may have in order to refine the system, and I'm grateful to my honourable friend for raising the point.
Patricia Gibson.
Thank you, Mr. Speaker. It is worrying that the Minister fails to even allow for the possibility that it is entirely possible that much of the world may follow Bulgaria and place travel from the UK on a red list. If this were to happen, what comfort can the Minister offer to the UK travel sector? And does he not recognise that now is the time for additional support for this beleaguered sector, as travel disruption looks set to continue for the foreseeable future?
Mr. Speaker, it's difficult for me to comment upon these steps that other countries may have taken or may take in the future because they all have their own differing systems. What we do is continue to talk to all of our international partners, both in multilateral and in bilateral forums, in order to understand how we best can enable travel between us, for all the reasons that we've discussed in the House today.
Mark Jenkins.
Thank you, Mr. Speaker. I welcome the work of my honourable friend on the reopening of international travel, while members opposite sought a complete shutdown. This has only been possible thanks to the success of our historic vaccine rollout. But while we see the country opening up further today, travel companies in my constituency of Workington still have some very rough months ahead, even were travel to be unencumbered completely. They found themselves low down the grant priority list after 16 months of only refunding customers. Where the government confiscates, the government must compensate. Will he therefore add his weight to calls to the Chancellor for ongoing sector-specific support?
Well, I'm grateful to my honourable friend for raising that question. Again, he's quite right to draw attention to the travel agencies in his constituency who are, of course, having a very challenging time. I entirely recognise the difficulties that they have. I will say to my honourable friend, as I've said to other honourable members, the best way we can help all of these sectors is by having the vaccine, rolling out the vaccination programme as we've been doing, and then ensuring that we can restart international travel in a way that protects public health.
Let's go to Rachel Maskell. Rachel.
Thank you, Mr. Speaker. Travelling through the Channel Tunnel or by air or circulating their respective terminals means that the public are not just in public places, but workplaces. In the light of soaring infection rates, will he ensure that all measures under the Health and Safety at Work Act and Employment Rights Act are taken to protect our transport workers, including public health measures like wearing a mask and social distancing to stop the transmission of COVID-19?
There's a number of different points raised in the honourable member's question. As far as the law is concerned, all employers and all workplaces, of course, have to enforce the law as it stands. Parliament has legislated, and that, of course, must be enforced, and there are authorities to do that. With regards to COVID-safe travel, there's a lot of detailed guidance which has been made available, and I would expect everybody to continue to follow that detailed guidance to keep everybody safe, as indeed they very much are doing. Some travel providers may decide to take steps in addition, such as making a mask a condition of carriage or a condition of entry, and I'm confident that those assessments that each travel provider undertakes on their premises or in their transport means will enable everybody to travel and to remain safe whilst they travel.
And Spencer.
Thank you, Mr. Speaker, and I very much welcome that fully vaccinated people can now travel to amber countries without having to quarantine on return. But of course, I'm disappointed with the change in situation with France and effectively the creation of a new orange-red category. It's right the government acts quickly, and it would have been a disaster if France had become a red country. But new variants are going to keep on coming, that's inevitable, and what the sector needs and families and travellers need is certainty and predictability. So can my honourable friend assure me that at the next review this would be looked into, particularly around certainty and predictability, and that the traffic light system remains a traffic light-free prong system rather than covering all colours of the rainbow?
Minister.
I'm very keen to reassure my honourable friend, Mr. Speaker, that the system that we have laid out in the Global Travel Task Force report, the red, amber, green system, remains in place. There has been a precautionary measure taken for the reasons explained with regards to France. I do agree with my honourable friend that certainty is what we would like to provide. We aim to do that through the system that we have. One of the difficulties, of course, is that if a situation develops in another country with regards to a variant or increased prevalence, we do have to react to that, and I think it's right that we do. But in answer to his question, will these matters be kept under review as we continue to consider policy? Of course they will.
Thank you, Mr. Speaker. Infection rates are at the highest we've seen since January. The Secretary of State for Health has said that he expects a spike following the relaxation of regulations today. So how can it be responsible of the government not to require people wearing masks on transport? People spend long periods of time next to one another on planes, on trains, on the underground, on buses. How can it be responsible not to require people to wear masks in those environments?
So there's two parts to answer that question. I think the honourable gentleman is referring to the broad range of transport rather than simply international, maritime or aviation, for example. He refers to domestic as well. In what the government is seeking to do is to ask people to exercise their own judgment and their own responsibility, which is, of course, what a situation we do have to get back to. But in some circumstances, we have made clear that we would expect masks still to be worn, and some travel providers have also made that stipulation. And if that's the case, then it's right and that people follow it. The reason for that is there are, of course, very different circumstances between, for example, a crowded tube train or a rural train late at night when there's only one person on the train. There are different circumstances. We're seeking to take allowance for those.
Mr. Speaker, I want to touch further on the points raised by my honourable friend for Wellingborough. When I visited Blueberry Travel, which are a travel business based in my constituency in Stoke-on-Trent South recently, they particularly raised the mismatch which is causing issues for some countries between the traffic light advice, which would allow people to come back into the UK, and Foreign Office travel advice, which prevents them from leaving in the first place. So could my honourable friend please look at what more can be done to better join up this advice to make it easier for travel businesses and for those wishing to travel abroad?
I'm very happy to assure my honourable friend that I and DfT more broadly will continue to talk to our colleagues across government to see what more can be done. I do have to point out again, of course, the fact that the two issues are dealing with different aspects or almost two sides of the same problem. What we are dealing with is the risk of importing the virus or variants of the virus back into this country. What the Foreign Office are seeking to do is to give advice to British citizens when they travel abroad. So whilst we'll obviously continue to talk to each other, they are dealing with fundamentally different things.
Let's go to Dame Diana Johnson. Diana.
Thank you, Mr. Speaker. To add to the confusion over international travel announcements in recent days and the increasing rates of COVID, we all know that masks cut the risk of getting COVID and passing it on to others. But leaving face coverings to personal responsibility is just a recipe for confusion, conflict, chaos, and of course more COVID. And it leaves 3.5 million clinically vulnerable people frightened to travel. So shouldn't wearing a mask just be compulsory on all modes of transport?
It's right, Mr. Speaker, that we allow those transport providers to assess the situation on their own mode of transport and to make that a condition of carriage if required. And in other circumstances, I think it's right that we do trust people to take the right decision for themselves and those around them.
We now come to Jameson.
Mr. Speaker, it's great that international travel is now happening again, and I'm absolutely clear that we must continue to do all we can for our aviation, travel, leisure, hospitality sectors. Could I please, however, draw the Minister's attention to the high cost of COVID testing? Our families returning from holidays are forking out lots of money for this. So could I please ask him to consider the uniformity of the policy and also get the cost down, please?
Again, my honourable friend raises a critically important point. We are working with industry and across government to see how we can help with the cost of testing, something that the government is aware of. We seek on the website, which shows different providers, to enable the information to be available for consumers. And my honourable friend will, of course, have noticed that the cost of testing has been coming down over the course of the last few weeks and months. And I'm confident that as we see more travel in a safe, sustainable way, that will come down further.
Let's go to Marion Fellows. Marion.
Thank you, Mr. Speaker. The Minister didn't answer the question on support for the aviation sector and associated sectors, such as the travel industry and hospitality, posed by my friend, the Honourable Member for Paisley and Renfrewshire West. So here we go again. Has his department lobbied the Treasury for additional funds to support jobs in these sectors? And if so, what was their answer?
Of course, Mr. Speaker, the Honourable Lady will be aware that we estimate that the aviation sector itself will have benefited from approximately £7 billion worth of support by September, as well as the other sectors which have benefited from the cross-economy support schemes that the government has put in place. And that the best way that we can assist all of those sectors is that we unwrap international travel as soon as we can, whilst protecting public health, because that's the best way to help them.
Thank you, Mr. Speaker. Now, almost 70% of Ashfield residents have been double jabbed, and whilst that's giving back our domestic freedoms, does the Minister agree with me that another freedom we need to get back is foreign travel, which will give our aviation industry a much-needed boost?
Mr. Speaker, I am very keen to see foreign travel because of the immense benefits it brings this country in terms of individuals' life experience, in terms of the jobs that it brings in, the money that comes in to the Treasury, the families who need to be connected, the businesses who rely on international travel. I'm very keen to see all of that increase as much as we can. We do have to do so, however, in a way that reassures the public that we are protecting public health.
Let's go to Maria Riedel. Maria.
Thank you, Mr. Speaker. The Minister's regulations require people wanting to travel abroad to have PCR tests. So when will the government publish an up-to-date and accurate list of suitable recommended PCR test providers for travellers? And what will he do to protect travellers from those companies that charge a lot and then don't deliver timely results, thus ruining travel plans for families at the last minute?
The list of providers is a is continually reviewed by the Department of Health and Social Care, and they have a rolling programme, and they do take action if providers are not delivering what they have promised.
Mr. Butler.
Thank you, Mr. Speaker. Travel to the US is very important for businesses headquartered in my constituency. Several own major US subsidiaries which they cannot adequately oversee. You cannot tour a factory, for instance, by Zoom, and many have major US investors whom they cannot update. Can you assure me that you are doing everything to get a travel corridor in place with the US? I know that we have the task force because it is essential that we can have travel going in that direction.
My honourable friend gives a perfect example of the importance of why it is we do need travel, because there are certain things you can't do over Zoom, and she's quite right to draw attention to that. But transatlantic travel is hugely important to the United States and to the United Kingdom for very many reasons. Obviously, this has been greatly affected by the pandemic, and it's kept families apart and it's made trade difficult, and with our closest ally, we want to restore that as soon as we possibly can. Of course, as you will know, the Prime Minister and President Biden made clear the importance of bringing about the return of safe travel as soon as is possible, and that's why the joint UK-US experts working group that she refers to has been formed, and work is well underway to deliver that goal as soon as possible.
Thank you, Mr. Speaker. Significant concerns about conditions for people returning to the UK and in the quarantine hotels have been raised by members of this House and also by the directors of public health for the local authorities around Heathrow Airport. One cannot book a flight until the quarantine hotel is booked. My constituent had to wait over a week to receive vital HIV medication while waiting to enter the UK, and then again while in the quarantine hotel. He contacted me and we were fobbed off by being told, quote, the hotels have on-site doctors, when he needed a specialist doctor to prescribe. He had to wait too long to receive his essential medication. This is unacceptable, and I worry how many other people's lives and health are being put at risk due to these delays and poor management of the quarantine hotels and the arrival system. So what steps is the Aviation Minister taking to prevent this happening to others arriving to the UK?
Well, Mr. Speaker, I'm concerned to hear about the case that the honourable member raises, and if she would like to share it with me in writing, I will ensure that that complaint is sent to the right place and that it is addressed. So on that individual case, I'm very happy to take action. More broadly, the government, of course, continues across government to ensure that the policies we have in place are not only accurate and required, but are carried out to the satisfaction of all involved. And this has obviously been a fast-moving circumstance, and we're all committed to make sure that the policy is delivered and that quarantine hotels are managed in appropriate fashion.
Final question, Simon Jupp.
Thank you, Mr. Speaker. I'm sorry to say that further restrictions for France, stretching both the credibility of the system put in place and the patience of the travel industry, the whole industry, from regional airports, including Exeter, to travel agents in places like Sidmouth, continue to watch as their reserves are dried up. Their support is reduced from the government and their ability to trade is hampered beyond any other industry. Will my right honourable friend look again at bespoke support for the travel and aviation industry to avoid further job losses affecting hundreds of thousands of people?
Mr. Speaker, the travel industry and regional airports, particularly Exeter, have very powerful voices in this place, not least my honourable friend, who is exceptionally eloquent and exceptionally powerful in making their case to me and to others. I commit to remaining in close contact with him and to all in the sector in order to best understand how we may be able to support them. And the best way to do that, as I've said, is to ensure that we are able to travel in a way that protects public health, but nonetheless it enables that travel.
I'm now suspending the House for 2 minutes to enable necessary arrangements to be made for the next business. Order. Order. I call Minister Nadhim Zahawi to make a statement. Minister.
Thank you very much, Mr. Speaker. With permission, I'd like to make a statement on the pandemic. Today marks an important milestone, Mr. Speaker, in our fight against this virus, and we take step 4 on our roadmap. It is a long-awaited moment for the businesses who now can open their doors at long last, the happy couples who can have weddings without curbs on numbers, and, of course, the people who can see more of their loved ones in care homes. Although we have made huge advances, Mr. Speaker, in our race between the vaccine and the virus, we are not at the finish line yet. Instead, we are entering what I believe to be the next stage, a stage where we continue with caution while doing what it takes to manage the risk of this virus, which is still with us and still possesses a threat. Cases and hospitalizations have risen over the past week, as we predicted, Mr. Speaker, and we know that these numbers will get worse before they get better. Although there's never a perfect time to take this step, making the move today gives us the best chance of success. We're cautiously easing restrictions when we have the natural fire break of the school holidays and when the warmer weather gives us an advantage. So we will move forward with caution, drawing on the defences we have built as we set out in our 5-point plan 2 weeks ago. One of these 5 defences is the protective wall provided by our vaccination programme, and I would like to start by updating the House on this life-saving work. Our vaccination programme has given us extra legs in our race against this virus. The protection it has built up in people across the United Kingdom means the ratio between cases and hospitalisation is the lowest it has been during this pandemic. This reinforces the need to protect as many people as we can, as quickly as we can. And we made a 4-week delay to step 4 so we could do exactly that. 8 million more vaccinations in that period. We set the target of giving second doses to 2/3 of the United Kingdom adults by today, and we hit that target last week with 5 days to spare. We also pledged to offer a first dose of a vaccine to all adults, and we've met this target too. And now almost 88% of adults have taken up this offer, and although uptake amongst 18 to 30-year-olds is much lower and needs to increase, but we are in a good place. So, Mr. Speaker, our work is not over yet. Just as we strive to reach the remaining adults who have not yet had first or second doses, we are already making our plans for the next stage, because we do not know how long immunity lasts. And because coronavirus mutates, just like flu, we must stay one step ahead of the virus. So we are drawing up plans for a potential booster programme, subject to the final advice from the JCVI, so we can protect the most vulnerable ahead of winter. And we're also looking at extending our vaccination programme so we can protect even more people. We asked the JCVI to consider whether children and young adults should be given the offer of a vaccine, and this advice has been published today. Mr. Speaker, before I continue, allow me to apologise to you for mistakenly referencing this on air this morning before setting out the details in full before the House. The JCVI considered not just the health impacts, but also the non-health impacts, as we asked them to do so, like how education is disrupted by outbreaks in schools. I should reassure the House that the number of children and young people who have had severe outcomes from COVID is extremely low, with a hospitalisation rate during the second wave of between 100 and 400 for every million. And when we look at the small numbers that were hospitalised, most of them had severe underlying health conditions. Today's advice recommends that we continue to vaccinate 16, 17-year-olds who are in an at-risk group, as we do now. But it also recommends expanding the offer of the vaccine to some younger children with underlying health conditions that put them at greater risk of COVID-19. This includes children aged 12 to 15 with severe neurodisabilities, Down syndrome, immunosuppression and profound or multiple learning disabilities. Mr. Speaker, the JCVI advice also recommends offering a vaccine to children and young people aged 12 to 17 who live with someone who is immunosuppressed. This means we can indirectly protect the immunosuppressed who are at higher risk of serious disease from COVID-19 and may not generate a full immune response to vaccination. Finally, the JCVI advises that we should offer the vaccine to all 17-year-olds who are within 3 months of their 18th birthday, so we can make sure they are protected as soon as they turn 18. Together with health ministers in all parts of the United Kingdom, the Secretary of State has accepted this advice and has asked the NHS to put into action as soon as possible. As we do this, we will be using the Pfizer-BioNTech vaccine, which is the only vaccine in the UK that's been clinically authorised for people between the ages of 12 and 17. I know that people will have questions about what it means for them and their children, but I can assure them, Mr. Speaker, that nobody needs to come forward at this stage. The NHS will get in touch with them at the right time, and they will make sure that the jabs are delivered in a setting that meets their complex needs. We also ask the JCVI to consider rolling out vaccines to all children and young people over the age of 12. And although we are not taking this step today, the JCVI is keeping this matter under review, and they will be looking at more data as it becomes available, especially on children with a second dose of the Pfizer-BioNTech vaccine. The steps we are taking today mean we will be offering even more vulnerable people the protection that a vaccine brings, and we will all be safer as a result. Mr. Speaker, we know that vaccines are our most important defence against this virus. This is especially the case in adult social care settings that are home to some of the most vulnerable people in our communities, who are vulnerable to a devastating impact from COVID-19. So last week, this House passed regulation to make vaccination a condition of deployment in care homes, and the Lords will consider those regulations tomorrow. These regulations are designed to help maximise vaccine uptake and protect some of our most vulnerable citizens. Yet, I recognise the need for more detail on the government's analysis of the expected impact of these regulations. So today, we have published an impact statement, and we will be publishing a full impact assessment as soon as possible. Mr. Speaker, as we learn to live with COVID, we must be pragmatic about how we manage the risks we face. Self-isolation of positive cases and their close contacts remains one of the most effective tools we have for reducing transmission. However, we recognise there are some very specific circumstances where there would be a serious risk of harm to public welfare if people in critical roles are unable to go to their workplace, like air traffic controllers or train signallers. So people in those kinds of roles who have received 2 vaccinations plus 2 weeks beyond the second vaccine will not need to self-isolate to perform those critical tasks. They will, however, have to continue to self-isolate at all other times. The people eligible for this will receive personalised letters setting out the steps they must follow. Mr. Speaker, this is a sensible and pragmatic step, and one that will be used sparingly and responsibly. Mr. Speaker, we are being similarly pragmatic at our borders. As my right honourable friend, the Transport Secretary, has confirmed, UK residents arriving from amber countries who have been fully vaccinated will no longer have to quarantine, although they will still need to comply with necessary testing requirements. This will not apply to France due to the persistent presence of cases of the Beta variant, which was first identified in South Africa. We are doing everything in our power to restore international travel and restore it safely, but new variants pose the greatest threat to our path out of this pandemic, and we will not hesitate to act in a similar way with any other country. We will continue to keep a close eye on the data and be firm and decisive in how we protect the process we have made and the progress we have made. But the enduring message is this, Mr. Speaker. Getting vaccinated is the best way to ensure you can travel as freely as possible. Vaccination also holds the key for doing the things we love here at home, Mr. Speaker. We are supporting the safe reopening of large, crowded settings such as nightclubs, as we saw last night, and music venues, with the use of the NHS COVID pass as a condition of entry to reduce the risks of transmission. I encourage businesses to draw on this support and use the NHS COVID pass in the weeks ahead. We will be keeping a close watch on how it is used by venues, and we reserve the right, Mr. Speaker, to mandate if necessary. By the end of September, everyone aged 18 and over will have the chance to receive full vaccination and the additional 2 weeks for that protection to really take hold. So at that point, we plan to make full vaccination a condition of entry to nightclubs and other venues where large crowds gather. Proof of a negative test will no longer be sufficient. Any decisions will, of course, Mr. Speaker, be subject to parliamentary scrutiny, and we will ensure the appropriate exemptions for those who have genuine medical reasons of why they can't get vaccinated. And I'm clear we will always look at the evidence available and do all we can to ensure people can continue to do the things they love. Mr. Speaker, our vaccination programme has put us on the road to recovery. We should all be proud of how this national effort is helping us take steps towards a more normal life, but we must keep reinforcing that wall of protection. Getting the jab, getting the second jab if you've had the first, and getting the booster shot if you're asked to come forward. And with such a deadly virus and the continued threat of new variants, our wall of protection must be more than just vaccines alone. We must continue to do all the other sensible things we know can keep the virus at bay. Getting tested, considering the advice, and continuing to act with caution. Taken together, Mr. Speaker, this will help us all enjoy these new experiences and safely slow the spread of this deadly virus. I commend the statement to the House.
I now call the Shadow Secretary of State, Jonathan Ashworth.
Well, Mr. Speaker, can I thank the Minister for advance sight of his statement? And firstly, can I start by just commenting that of course people have the right to protest against a lockdown that no longer exists. But will he join me in condemning the very ugly scenes of harassment, thuggishness, throwing of objects, pushing and intimidation directed at police officers outside on Parliament Square earlier? Now, moving to the vaccination of adolescents, he has said that a number of teenagers will be vaccinated. Can he tell us how many and by when? Now, of course, the MHRA have approved the Pfizer jab for all 12 to 18-year-olds. And indeed, countries like the United States, Canada, Israel, France, Austria, Spain, Hong Kong and others have started or will soon be vaccinating 12 to 18-year-olds. So why aren't we? Now, he quite rightly said that risk of death to children from COVID is mercifully very low. But children can become very sick, and they can develop long-term conditions, long COVID. Indeed, according to the ONS, 14.5% of children aged 12 to 16 have symptoms lasting longer than 5 weeks. So can he just spell out in detail the clinical basis as to why the JCVI have made this decision? Will he publish all their analysis and documents in the same way SAGE publish their analysis, not just the advice? And can he guarantee that this decision was made on medical grounds and not on grounds of vaccine supply? Now, he talks, of course, about infection amongst children being disruptive, or we know that infection amongst children is highly disruptive for learning. We've seen hundreds of thousands of children out of school. So if we're not vaccinating all adolescents, can he tell us what is the government's plan for September when children return to school? For example, will he consider using this summer to install air filtration units in every classroom or in every school across the summer? Now, testing is already stretched, with turnaround times lengthening. Can he guarantee that through the summer, especially when contacts can be released from isolation on the back of a negative PCR test in August, and into September when schools return, can he guarantee there will be sufficient PCR testing capacity to meet demand? Now, as we move into autumn and winter, we anticipate more flu and respiratory virus. Those are illnesses whose symptoms often overlap with COVID. So will he also now invest in our testing capacity, so alongside a COVID test, it can also be possible to test for flu and RSV this winter. We need multi-pathogen testing going forward. Now, Mr. Speaker, 3 weeks ago, the Health Secretary told us that unlocking would make us healthier, and he promised us it would be irreversible. But today, we have some of the highest infection case rates in the world, and the Mayor from Jaws has decided to reopen the beaches, recklessly throwing off all the restrictions with no safety precautions in place like mandatory mask wearing. It risks reimposing new restrictions in the future. It means the NHS is facing a summer crisis. Already admissions for COVID are running at around 550 a day, and hospitals are cancelling cancer surgery. Liver transplant operation cancelled at Birmingham last week. And throwing off all restrictions like this will see thousands suffer serious long-term illness. The clinically vulnerable and scared are feeling shut out of society, and selection pressure could see a new variant emerging, setting us back, evading the success of the vaccine programme, snatching defeat from the jaws of victory. It's reckless, Mr. Speaker, and doesn't have our support. And of course, more infections mean more isolation. Now, the NHS staff who will be released from isolation if double jab, but they will still want protection for themselves and their patients. So will he ensure that the standards of masks worn in NHS settings are upgraded to the FFP3 requirement as NHS staff have called for? And what is his plan to keep the economy functioning and public services functioning throughout the summer as more and more people are asked to isolate? Because we know that the Prime Minister's and the Chancellor's plan was to dodge isolation. So can he tell us how this random clinical trial that so helpfully randomly selected the Prime Minister, the Chancellor and the Chancellor of the Duchy of Lancaster was set up? Can he tell us what exactly happened between 8 a.m. and 10:38 a.m. on Sunday morning that persuaded the Prime Minister and Chancellor to withdraw from this presumably valuable clinical random study? And can he tell us how many other ministers have participated in this trial? Did he participate in this trial? And how many government departments and officials were involved and why? Because if he cannot answer these questions sufficiently, our constituents will rightly conclude that it's one rule for Tory ministers and another for the rest of us.
Thank you, Mr. Speaker, and I thank the honourable gentleman. He began well but ended with petty politics. But I will address the issue of clinical trials. Those trials of testing over a number of days began, I think, around December, and it wasn't just the Cabinet Office and Number 10 who were participating, but organisations like TfL and Heathrow and others would have participated as well. And the Prime Minister government makes thousands of decisions every day, every week. Not something that the opposite parties used to doing, certainly not their leader anyway. But nevertheless, I shall refrain from engaging in petty politics. Let me try and address some of his more substantive questions. Around the harassment and thuggish behaviour, I join him in condemning such behaviour outside the House of Parliament against our police officers. On the vaccination of 12 to 15-year-olds, he asked about the number for England. It's approximately 370,000 children who will receive that protection. We are at the moment not following the United States of America or Israel or other countries in vaccinating all children, albeit, as I said in my statement, the JCVI are continuing to review that data and are waiting for more data on second doses. Obviously, millions of children in the US have already received their first dose, but there's a time lag for second doses, and that is being kept under review. In terms of the advice, we publish the JCVI advice accordingly. And in terms of testing, the United Kingdom now has the capacity of over 600,000 PCR tests and many millions of lateral flow tests. I myself am not on that trial that he spoke about. But I do take a lateral flow test, and I tested negative earlier today, as I did on Thursday and Friday as well. But very happy to certainly have his support in terms of the JCVI advice in protecting the most vulnerable children, and of course asking them to make sure they review the data on all children. I would reassure him, finally, Mr. Speaker, that the decision was made not in any way taking into consideration volumes of vaccine. We have plenty of vaccine available for the vaccination of all children. If necessary, we've ordered more Pfizer-BioNTech vaccine, which is the vaccine that is approved. The decision was made by the JCVI based on looking at the data from other countries, and that is the decision that we will implement.
Other of the House.
Mr. Speaker, nearly 8 years ago, in Central Lobby on Saturday, the 7th of September 2013, when the G7 speakers were here as guests of your predecessor, I hosted the Japanese table when at 8 o'clock that evening, the fact that Tokyo would be the Olympic Games city was announced. We send our sympathy to those who are affected by COVID there, and we wish the Games success. Turning to domestic NHS, can I put to the government what's been put to me by a community sister who says that in testing every day voluntarily, she's been going to having tests, she's been getting 3 months' supplies of tests before going to other people's homes. The system appears to have changed, and each member of staff like her has to apply for 7 days tests, which get sent to her home. Much more waste, much more work for each member of staff. Could the government please get together and see whether it's possible for those who work for the NHS, who want to test each day, can get bulk supplies from work and cut out some of this unnecessary extra work, please?
Minister.
I'm grateful for my honourable friend, the member for Worthing West, and he asks an important question, and I will certainly take that feedback very seriously and take it back to the team in terms of making sure we get the most efficient operational way of delivering the lateral flow test to the front line.
Video link. Martin Day.
Thank you, Deputy Speaker. May I thank the Minister for his statement. It is important that we follow the science on this issue, and I welcome the clarity from the JCVI on this matter. As Pfizer is required for young teens and Pfizer or Moderna vaccines are required for young adults, and the supply of these looks to be the lowest since February, what assurances can the Minister give that delivery will be sufficient? With many younger adults being unvaccinated and some being more complacent about COVID, how does the Minister propose persuading more of them to vaccinate and dramatically reduce the risk of serious disease? The UK now has more daily cases than any other state in the world, and as the Health Secretary has demonstrated, it is still possible to catch and therefore spread the virus when vaccinated. Last week, over 1,200 scientists, doctors and disease experts said that the UK government and its complete and immediate unlocking of England, with only 54% of the whole population fully vaccinated, was, it said, a threat to the world. Will the UK government accept responsibility should the concerns of these experts come true? And finally, the Health Secretary has spoken, as his predecessor did often, of the need not to politicise the pandemic. Can the Minister explain why his party colleagues in Scotland are attempting to attack the Scottish Government for its vaccine programme, despite the fact that a greater proportion of people in Scotland have been vaccinated than in England? Does he condemn his party colleagues' attempts to politicise the vaccine rollout in Scotland, or does he consider their untruthful claims to be acceptable?
Thank you very much, Mr. Deputy Speaker. The honourable member for Linlithgow and East Falkirk raises a number of important questions. On Pfizer supply remains consistent, and we have every confidence that the manufacturer will continue to deliver as they have been according to the delivery schedules. It is not a question of supply to be able to continue to vaccinate both the over 18s with their first dose and, of course, their second dose by the end of September, or now, as we did a few hours ago, jointly with Minister Hamza Yusuf and the ministers from Northern Ireland and from Wales, taken the decision that we will all follow the JCVI advice on vaccinating the vulnerable children and, of course, those who live with vulnerable adults, as I described in my statement. In terms of our capability in the UK to manage this pandemic, and I hope with the booster campaign in September, transition it from pandemic status to endemic status. I think the wall of vaccinated adults, almost at 88%, I think 87.9% with the first dose in the United Kingdom and 68% of all adults with 2 doses. This is the right precautionary, pragmatic decision to transition this and return our country to as normal a place as possible, and of course get those businesses that were first in almost and now last out of the pandemic back up and running.
The Health Select Committee, Jeremy Hunt.
Thank you, Mr. Deputy Speaker. Thanks to the efforts of the Minister, we have one of the best vaccine programmes in the world. So I hope he doesn't mind me expressing 2 concerns about our current strategy. First of all, if we're going to introduce COVID vaccine passports for nightclubs by the end of September, which I support, why are we waiting until then, giving more weight to the concerns of people who want to go to nightclubs than the additional extra cases waiting 2 months is likely to cause at a time when that growth in new cases is of such a concern? And secondly, on the NHS app, people who have been double jabbed know that if they are pinged, they are less likely to have the disease, and they are therefore starting to ignore the request to self-isolate and in some cases delete the app. Before we lose social consent, should we not replace the requirement to isolate for 10 days with a requirement to isolate until you've had a negative PCR test, thus using that testing capacity that he talked about to keep our national show on the road?
I'm grateful for my right honourable friend's really excellent 2 questions rather than 1. Let me try and address them in reverse. So on the NHS app, he would have heard the announcement today on frontline social and healthcare staff and, of course, on critical workers that I made in my statement. Part of the reason that we want to do that is, of course, because we want to maintain that workforce's ability to do what it does best. Now, they'll do that, as he quite rightly outlined, with a negative PCR test and 7 days of lateral flow testing. The very clear clinical advice from the Chief Medical Officer and the expert team is that the 16th of August would be the most appropriate time to do that for the rest of the economy as well, because as we open up, and obviously now we are at step 4, getting more people double jab and protected further, especially younger parents, teachers and other professions as well, then this is the appropriate measure to take, which is to do it on the 16th of August. On the issue that he raises around nightclubs, again, by the end of September, 18-year-olds will have received their 2nd dose. And we will work with the industry to make sure we get this right now in terms of working with them with the COVID pass and, of course, in September while we collate the evidence.
Nira Wilson.
Thank you very much, Mr. Deputy Speaker. Like hundreds of thousands of other school children, my 7-year-old daughter is out of school at home today, self-isolating. I'm sure he'll agree with me that children have paid far too high a price in this pandemic in terms of their mental health and education with missing out on school. Yet just last week, Professor Whitty said we may see new restrictions in 5 weeks' time, which is just before schools return. The Department for Education issued new guidance to schools saying they must be prepared to deliver remote education in the autumn. And today he has said he will not be vaccinating all teenagers. So what guarantees can this government provide to pupils and parents across the country that schools will reopen in September fully and safely and stay open? Will he rule out any further school closures?
I'm grateful for the Honourable Lady. I would just say to her that we and the devolved administration have accepted the advice from the Joint Committee on Vaccination and Immunisation to vaccinate vulnerable children and those children that live with vulnerable adults and 17-year-olds close to their 18th birthday. but they are keeping under review and looking at more data emerging from other countries, including the United States of America, as to whether we should vaccinate all children. I would give her the reassurance that children will have 2 supervised tests upon their return, and testing will continue until the end of September. So it is a combination of that and, of course, vaccinating at scale all adults as well, which helps us control transmission, because we know double vaccinated people obviously reduce transmission rates by about 50%.
Video link. Richard Drax.
Thank you, Mr. Deputy Speaker. My honourable friend said at the start of his statement that the disease was still here and we are not out of the woods yet. The fact is that variants of COVID-19 will be with us for many, many years to come. If we are to truly live with this virus, Freedom Day must mean what it says. The alternative is utter confusion, with hundreds of thousands of people having to isolate after being pinged by the NHS app. Here in Dorset, the police are beginning to struggle because of the numbers who have to isolate. Can my honourable friend tell me that the emergency service, I think he referred to there, includes the police, that if they are double jabbed, they do not have to isolate before law and order becomes a real difficulty to enforce in here, Dorset, and I also believe down in Devon and perhaps in other parts of the country.
I'm grateful for my honourable friend question. He's absolutely right that we take this step both confidently but cautiously. I have to remind the House that this is probably the most infectious respiratory virus that known to humankind, aerosol transmitted, so we really do need to make sure that we are careful as we head to step 4. I outlined to him the action we're taking on key workers, critical workers, and of course the police would fall within that as well.
Video link. Graham Morris.
Thank you, Mr. Speaker. May I congratulate the Catch Up with Cancer campaign, whom I hope to join tomorrow in delivering a petition to 10 Downing Street, and to thank them for their tireless work over the last year, pressing, petitioning and lobbying the government to deliver urgently needed ring-fenced investment for our NHS cancer infrastructure, so cancer patients can get the timely diagnosis and treatment they need. And may I ask the Minister, Mr. Deputy Speaker, he mentioned the expert advice in his opening statement. Can he outline his plans to ensure future protection for those immunocompromised or immunosuppressed groups, such as those living with cancer, such as myself, who may still be at risk from COVID-19 despite the vaccine rollout?
Thank you very much, Mr. Deputy Speaker, and I thank the member for Easington for his questioning. He is an attendant at the Friday briefings that I offer colleagues. He's absolutely right to highlight this group. There was some encouraging real-world data from Public Health England published last week that 2 doses of the vaccines offer around 74% protection for those who are immunosuppressed compromised. Now, that is to be taken with a caveat that that group of people is not homogeneous in any way, and actually we need to unpack some of that real-world data. The JCVI have already recommended in their interim advice on the booster campaign in September that they go top of the list for the 3rd dose as a boost for that group. And of course, we've got a very large clinical trial which is imminent in reporting in terms of the immunosuppressed, immunocompromised, and we will look at that data with the JCVI. And of course, Chief Medical Officer continues to ask the JCVI to look at how and what else we can do to protect that group, including the Therapeutics Task Force, which is doing some tremendous work on some therapeutics work there.
Video link. Caroline Noakes.
Thank you, Mr. Deputy Speaker. There is some real concern amongst my constituents that they might in some way have the wrong batch of AstraZeneca vaccine. My honourable friend provided a useful update on Friday of last week, but I wondered if he could give any further reassurance that no British traveller is going to be turned away at the border because they've been given the wrong vaccine.
I'm grateful to my honourable friend, the member for Romsey and Southampton North. She's quite right. There is no such thing as a wrong batch of AstraZeneca Oxford vaccine in the United Kingdom. Our independent regulator regulates all manufacturing sites for AstraZeneca, for Pfizer, for the other manufacturers as well. And the AstraZeneca vaccine produced in the Serum Institute is the same vaccine, the Vaxzevria vaccine brand that is approved by the MHRA and the EMA. There were some press stories and indeed some local confusion in parts of the world like Malta last week, which both the MHRA, the EMA and the Commission helped to clear up. And I reassure her that anyone who's had an AstraZeneca Oxford vaccine and has the UK app to demonstrate their vaccination or the letter will have the ability to travel. I think there are now 33 countries around the world who recognise our vaccine certification.
Debbie Abrahams.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, many of my former public health colleagues are very concerned about the lifting of mitigations today in the context of escalating case rates, 50,000 currently at the moment, 12 million people who have not been vaccinated, and an NHS and care workforce that are frankly on their knees. So what estimates have the government made of extending the wearing of masks and other mitigations after 3 weeks after 80% of the eligible population have been vaccinated, on incidence of long COVID, on hospitalisations and on deaths?
I'm grateful for my honourable friend's question. I have to say that the vaccination programme would have in no way been able to deliver the extraordinary uptake without the backbone of it being very much the NHS doctors, nurses, GPs, pharmacists, of course working with our armed forces, with local government and with the private sector to deliver, and the vaccine, the volunteers and the police. Absolutely right. The Honourable Member reminds us all of the role that our policemen, men and women played in making sure that vaccinations work well. The very clear guidelines is that we take both personal and corporate responsibility. It's great to see, whether it's Transport for London or other transport systems, the metro mayors, the M10 that I speak to regularly, taking that corporate responsibility. We all have our part to play in this, as we have done by coming together and vaccinating at scale the country. This is the most infectious respiratory disease that is transmitted, that is aerosol transmitted, and we have to be very, very careful to make sure we take the step carefully, and for it to be irreversible, then we have to continue to work together with the booster campaign and then beyond that in years to come to get used to transitioning it from pandemic to endemic status.
Anthony Brown.
Thank you, Mr. Deputy Speaker. As various members have noted, the number of cases of coronavirus is rising very rapidly, but the great success of the vaccination scheme means that the number of deaths remains very low. That means the fatality rate of coronavirus is now similar to that of other endemic viruses. Does my right honourable friend agree with me that with coronavirus now in around 200 countries around the world, almost every country in the world, that the chance of eliminating it is almost zero? And so as a society, we have to learn to live with it as we do with other serious infections such as flu and pneumonia.
Thank you, Mr. Deputy Speaker, and I thank my honourable friend, the member for South Cambridgeshire, for his excellent question. And I do agree with him. And I remember when I took on this role of vaccine minister back in November of last year, I explained to the House and to the country that the reason we began vaccinating phase 1, which is the most vulnerable cohorts as set out by the JCVI to us, the 1 to 9 categories, was where 99% of mortality was coming from because of this virus. That work has gone incredibly well. In all those categories, we have uptake of over 90%, in the high 95, 96%, in some of the one of them in 100% even. And of course, very high uptake in the second dose as well. And I think it's right that we now take this step pragmatically but cautiously as we transition, as I've been saying today that we move this from pandemic status to endemic, and we help the rest of the world do the same thing.
Chris Bryant.
Thank you, Mr. Deputy Speaker. Nearly 5 million people in the UK, because of the pandemic, are now waiting for hospital treatment of some kind or other. In many cases, those are really important operations, whether for eye operations that could save people's life, or eyesight, or improve their eyesight now, or for hip and knee operations and things like that. Now, everybody gets that the NHS has been really stretched, but the problem is thousands and thousands of people are now going, well, you know what, if I pay £3,000, £5,000, £10,000 or £20,000, I can get that new hip, that new knee operation done on the private sector. It's exactly the same doctor as you would see in the NHS, but I can still do it in the private sector. That is surely unfair. Surely we must say that the NHS is going to buy up every single piece of spare capacity in the UK to get this backlog down as fast as possible, including for cancer care, and all the minor things that might seem like minor but make a dramatic difference to people's quality of life, like hips and knees.
Thank you very much, Mr. Deputy, and I thank the member for the Rhondda for that very thoughtful question. She's absolutely right. It's about 5.3 million people, and he's also right that we have to make sure that the NHS has the resources to be able to do this, which is why two things have happened. One, the Secretary of State has made it very much a priority, so dealing with the pandemic, but also dealing with the backlog as an equal priority, and made £1 billion available for the NHS to be able to do that work.
Video Inc. Sir Bernard Jenkin.
Thank you, Mr. Deputy Speaker, and may I thank my right honourable friend for his statement. But can I confess to some disappointment that the daily vaccination rate is not being sustained at a higher level? What is the constraint? Is it supply? Is it logistics? Or is it that the hard-to-reach groups are slower in coming forward? And what consideration is the government giving to what is happening in other countries like the United States, where people are being offered some kind of reward for coming forward and accepting a vaccination?
I'm grateful for my honourable friend's question, Mr. Deputy Speaker. I think if the vaccination rates in the United Kingdom have been incredibly high. We're at 88% with first dose, and of course 68% with double doses. We're actually ahead on double doses than the United States of America, but that doesn't mean we become complacent. We are doing everything we can to make sure that every cohort, every ethnicity has the ability to access the vaccine. Let me give him an example of some great work in one of the boroughs in London, in Newham. Last week, they had 23 different sites of vaccination, whether in pop-ups, in mosques, or in GPs, or pharmacy, community pharmacy, across the borough. Literally, young people were tripping over a vaccine site. And so part of it is access, part of it is going and taking the vaccine to those communities. I have a number of colleagues that I'm doing work with to make sure we get it to some rural communities, for example, with vaccine buses, and of course in community centres that people feel safe and comfortable to take their vaccine. But the work does not end today. We continue to double down our effort to continue to vaccinate. And I want to place on record my thanks to the Metro Mayors for the work they do with us to make sure that happens as well.
Jim Shannon.
Mr. Deputy Speaker, the Minister, of course, has been thanking everybody else, but I think we also need to thank the Minister and his department and his team and the NHS staff for all that they have done as well for the vaccine programme. Given recent news that those aged 12 to 17 will be offered a COVID vaccination to protect them in the colder weather, has the Minister come to an assessment on how effective this will prove to limit the spread of COVID-19 in schools, and what discussions has the Minister had with his Education Minister to deliver the vaccine rollout? Thank you.
I'm grateful for the member for Stratford. He's always wonderfully complimentary and polite, and I'm grateful for his compliments, and I will take those back to the team as well. We have conversations all the time. We are making preparations for a co-administration of flu wherever possible with the COVID boost beginning early September, based on the interim advice from JCVI. The only caveat is obviously that is interim advice and it could change as they get more clinical data through. We've got a big trial on 7 of our vaccines to see which one delivers the best boost possible, and when they get that data back, we will firm up their advice. But operationally, we aim to begin in September.
Video link. Steve Bryan.
Thanks very much, Mr. Deputy Speaker. I'm obviously pleased that we've reached step 4A of the roadmap, but I'm keen to understand what lies behind the month-long gap between July the 19th, when it does feel as if we don't believe in our vaccines as much as we might, and August the 16th when we do. So can I ask my honourable friend, what is the scientific basis for the decision to give my fully vaccinated constituents their real freedom after the middle of next month, but not now?
Thank you very much, Mr. Deputy Speaker, and I thank my honourable friend for his excellent question, as always, the member for Winchester. And although most restrictions obviously have been lifted and many people have now been vaccinated, as I've been setting out, it is still possible, obviously, to catch and spread COVID, even if you are fully vaccinated. So introducing this exemption in August will allow more people to be fully vaccinated, as I mentioned earlier in an earlier answer. Unlike in previous waves, Mr. Deputy Speaker, the rise in cases driven by the Delta variant is not translating into significant increases in hospitalisation and death, and this is due to the effectiveness of the vaccines at reducing that risk of transition and severe illness.
Video link. Caroline Lucas.
Thank you, Mr. Deputy Speaker. As ministers recklessly lift almost all restrictions in England, despite the UK now having the 3rd highest number of cases of any country in the world, only Indonesia and Brazil have more, the efforts of public health leaders to keep cases down are being hampered by delays in accessing and processing PCR tests, with reports that the national booking system is being regularly switched off for hours at a time, and turnaround times for tests is lengthening. And that's before the even greater surge in case numbers that ministers freely admit we face. Now they've offloaded responsibility for managing the pandemic onto individuals and businesses. So my question is, can the minister clarify whether the 600,000 PCR test capacity he referred to a little earlier is per day? How many tests will we need per day if we get to 200,000 daily cases? And can he really guarantee that we have sufficient capacity in terms of those PCR tests to cope with the rising tide of COVID infections that this government is responsible for?
The Honourable Lady's question, Mr. Deputy Speaker. On the PCR test capacity, it is 600,000 per day. I looked at the data earlier this morning for yesterday, and I think it was just about half of that being utilised, about 300,000 odd tests. Of course, that doesn't include the millions of lateral flow tests that we are also capable of delivering.
Video link. Peter Bell.
Thank you, Mr. Deputy Speaker. Last Tuesday, the House passed a statutory instrument making it compulsory for care home staff to be vaccinated. The last time compulsory vaccination occurred was in the 19th century. I was slightly confused with what the excellent minister said in his statement. So could the vaccine minister confirm that a full impact assessment was completed prior to this contentious legislation coming to the floor of the House, and that he saw that assessment before signing off on the policy? After all, this was a major change in government policy.
Thank you, Mr. Deputy Speaker. And I'm grateful for my honourable friend, the member for Wellingborough, for his excellent question. As I mentioned in my statement, there has been an impact statement published today, and a full impact assessment will be made. I would just bring it to life for him to help him and to reassure him and the House. Barchester Health, one of the providers, has about 16,000 employees, so quite a large sample to look at. And they've implemented this policy early when they consulted with their workforce on duty of deployment. They managed to successfully get the workforce to be vaccinated. They're a priority list in phase 1 of the vaccination programme. Only 78 out of 16,000 of the workforce, so about 0.5%, actually chose not to and no longer work for Barchester Health. But that gives him, I hope, some reassurance that we look at this data very carefully.
Thank you, Mr Deputy Speaker. I'd like to pay tribute to the Minister for his work and probably the only functioning part of the government's response to COVID. But all of that work is at risk because of the Prime Minister's surrender strategy. In my Kirkcaldy and Cowdenbeath constituency, I have one case I'll give him as an example of a young girl who had 8 negative lateral flow test results. She was symptomatic, her parents insisted on a PCR, and that was positive. A cluster has grown up around the young person and their family, and they are obviously in great distress, not just because of her infection, but because of the consequences. So why does the government, both here and in the devolved countries, persist using discredited lateral flow devices that are not designed for use in asymptomatic subjects? They are designed for use in symptomatic subjects, and they are designed for use in the professional setting, but not in self-administering that test. Because we have domestic tests that excel in both, that beat the current tests hands down, but they are not being contracted. Can he please advise the House why the government is blind to the domestic diagnostics industry?
Thank you very much, Mr Deputy Speaker. I thank the Honourable Member for Kirkcaldy and Cowdenbeath for his question. I would just respectfully say that on the contrary, the government works with the diagnostics industry. Indeed, we were able to scale up. When we entered this pandemic, we were only capable of doing about 2,000 tests a day. We now have a PCR testing capacity of 600,000, as you heard earlier, and millions of lateral flow tests. And I think it's the combination of both those things that works. But if there are other companies in his constituency that he thinks, or elsewhere in the country indeed, that he thinks are worth looking at, I will certainly put them through to the relevant team in the department.
Video link. Andrew Salu.
Can I thank my honourable friend for his unfailing courtesy and diligence in responding to MPs week after week in respect of his duties, and also ask him if he could share with the House the results of the test to release experiment, because there are many businesses in my constituency. The Dining Yard restaurant in Leighton Buzzard had to close for a week, and I've been told that Go Bowling in Dunstable may have to close as well because of a lack of staff. So anything the Minister can share with the House on that issue would be very, very welcome.
Thank you very much, Mr Speaker, and I thank my honourable friend, the member for South West Bedfordshire. We are, as he quite rightly outlines, incredibly aware of the stress of self-isolation and that policy is placing on various workforces, and subject to the results of the clinical trials expected within the next 1 to 2 weeks. We hope to be able to extend the use of daily contact testing for some workplaces, though the initial focus will need to be on workplaces with established asymptomatic testing sites, or possibly those that can rapidly stand up ATSs too. Given the first clinical trial is for assisted rather than home-based testing.
Andrew Gwynn.
Thank you. We all want to see the back of this pandemic and see life return to normality, and history will no doubt judge the wisdom or otherwise of Freedom Day at this point in time. I want to focus, if I can, on long COVID, because it is a fact that the more COVID there is, the more long COVID there will be. And at its worst, it is debilitating. It's just awful, and I know that because I'm still suffering with it after 16 months. If the balance of risk is more long COVID, can I ask the Minister what more his government will do to help those with it in their health recovery, for help for employers impacted by an ill workforce, and in providing social security for those on the long-term sick with long COVID?
I am very grateful to the honourable member for his excellent question, and I wish him a continued recovery. I know from the work that I've certainly seen, it's not easy. I think there are just over 900,000 people who are suffering from different forms of long COVID. We've made an additional £150 million available for the NHS, both in terms of looking at long COVID and having an infrastructure to be able to deal with it and help support GPs to diagnose it as well.
Dr. Caroline Johnson.
Thank you, Mr Deputy Speaker. The Minister is aware of my reservations in asking children to be vaccinated where it may only provide very marginal benefit to them. But he will understand the importance of informed consent and people being given all the right information. So can he confirm, firstly, that where children with medical conditions are being offered the vaccine, that the risk posed to that child from COVID, of serious effect from COVID, is greater than the risk to that child posed by any vaccine? And can he also confirm that where children are being asked to be vaccinated to protect an adult who may be vulnerable for whatever reason, that those parents, carers and the child will be provided with the absolute, not relative, but absolute risk reduction posed for those individuals that they're being asked to vaccinate for?
Minister.
I'm grateful to my honourable friend's question. Her excellent participation in the vaccination programme. She is one of the heroes that I stand on the shoulders of. And of course, the work that she's done in Stevenage and North Highcombe. I would absolutely confirm to her, and the JCVI advice is very specific on the conditions of young people that will be eligible to receive the vaccine to protect them from COVID, and of course for those adults who are also vulnerable to it. And hence why in my statement I talked about the NHS being in contact with those families to be able to advise them and then facilitate the vaccination in a place and time that's convenient for them.
Judy Link. Geraint Davis.
The Health Secretary was double jabbed and got infected. In Swansea Bay, 18% of those infected in June were double jabbed and 31% were single jabbed. So does he accept that Freedom Day isn't the freedom to infect others, that masks and social distancing remain vital, that jabs are stopping people dying? And will he confirm that he's not pursuing a policy of herd immunity that would overwhelm the NHS and leave a massive legacy of long COVID disabling our economy?
I can certainly confirm that, Mr Deputy Speaker, and I would say that the guidelines are very clear that we are both supporting and recommending that people continue to be careful when in indoor spaces, crowded places, to wear masks and of course take both personal and corporate responsibility rather than having a government by diktat.
Mark Harper.
I'm grateful, Mr Deputy Speaker. I have to say I don't welcome the Minister's statement, actually, particularly his announcement of compulsory vaccine passports for crowded venues, which is effectively moving to compulsory vaccination. I do look forward, however, to the debate and the vote in Parliament in September when he'll bring forward the evidence, because I don't think actually that policy is supported by the events pilots that have taken place. But what I wanted to ask him about was the self-isolation regime. It's important for public confidence that it's supported by evidence. And it's the same regime we had before we had any vaccination and before we had any lateral flow tests. And it seems to me the government accepts that logic because it's going to move to a new, more sensible model on the 16th of August. I listened carefully to his multiple answers to colleagues on both sides of the House, and I'm afraid he couldn't really explain why we were waiting till the 16th of August. All the things that are true on the 16th of August about the risk reduction for those who are fully vaccinated from getting infected, they all apply today. And I have to say to the Minister, if the government doesn't move on this before the 16th of August, he'll either be back at that dispatch box or probably during the recess. Reality will intrude. I would rather the government did it in a planned, organised, controlled way, rather than having a bit of a shambles developing later this month. So I urge him, bring forward that announcement, bring forward those measures to today or this week. Don't leave them till the 16th of August. Do the right thing, and I think the country will thank him for it.
Thank you very much, Mr Deputy Speaker. My right honourable friend, the Member Forest of Dean, always makes thoughtful and important interventions, and I take his words incredibly seriously on both questions. One around sharing with the House the evidence, working with the industry, whether it's the nightclub industry or at-risk, large-scale events that are indoor. As I mentioned in my statement, we will come back to the House with that evidence. And of course, on the self-isolation issue, he, I hope, agrees with me that it's the right thing to do for frontline health and social care staff and for critical workers. I think the important thing is the clinical evidence and the Chief Medical Officer's very clear advice is, as we go through step 4, to have that additional buffer, if I can call it this, continue to vaccinate, double vaccinate, to allow people a little bit more, to allow us a little bit more time to make sure that people who are double vaccinated can then come out of that self-isolation, because we can move to a PCR negative or daily testing regime, is the right thing to do. We will keep it under review, and I take his words very seriously.
Thank you, Mr. Deputy Speaker. Come September, the settings that will be most vulnerable to COVID are going to be schools. School classrooms are going to have the highest percentage of non-vaccinated people in it of anywhere else. The government has scrapped the need for face masks. The government has scrapped the bubbling system, and it is now forbidden schools and nurseries from doing in-house track and trace and forced it onto the failing nationwide track and trace system. Now, I understand why we need to be really sensitive and cautious about vaccinating young people aged 12 plus, and I'm very cognizant of the comments made by the member for Sleaford. However, in other areas, the JCVI has made sure that we're at the forefront of global vaccination programme. Could he explain the conversations he's been having with the JCVI as to why they're being so cautious in this regard? Could he explain to the House when the JCVI will give updated advice, because really they should be being vaccinated over the summer if it is safe? And what I'm asking for specifically, to be very clear, is not a forced programme for children. It is for it to become available when the JCVI say it's safe, and for parents and families to have all the information they need so that they can make the decision on behalf of the interests of the child, the family, the community, and taking into effect educational scarring as well.
Thank you very much, Mr. Speaker, and the Honourable Member for Hove raises a really important question, and a question that we have asked the JCVI. I would say, though, for sort of his earlier remarks, that there will be 2 supervised tests upon return to school, but the other advantage will be that there is this wall of vaccinated adults that will continue to increase. I hear you. No, listen, I can absolutely understand, which is why the JCVI will continue to review the data on vaccination of children. Their concern, very specifically to his question, is they have received data from around the world, from countries that are already vaccinating, and we are, with those countries, at the forefront, but at the moment we're an outlier because they've chosen to move forward on children's vaccinations, and we have not fully. We're moving forward for children that are vulnerable and those who live with vulnerable adults. They want to look at second dose data. At the moment they've got first dose data. There is a very rare signal of myocarditis that they are concerned about, and they want to see second dose data from places like the United States before they make their decision, but that decision is under review.
Thank you, Mr. Deputy Speaker. It's good to see the Minister still standing this Freedom Day when it feels like half the Cabinet's been struck down or knocked out or whatever it is. Would he agree, at a time when worryingly we hear of increasing threats to vaccination centres, be it the vile anti-vax propagandists who are outside this building right now, or even people so keen to get jabbed that they leave vaccinators feeling vulnerable, that nobody should feel intimidated when seeking perfectly legal healthcare? And secondly, that there is scope for investigating an offence against violence towards NHS professionals in such a setting, be it verbal or physical, and it would bring it into line with the Protect the Protectors legislation we already have against ambulance staff and police. This was a suggestion put to me by The Florence Nightingale trainees I met last week, they were nurses. If he did it, he would be a hero amongst them, even though they didn't get their pay rise. What does he think?
Can I thank the Honourable Lady for Ealing Central and Acton? And I have to say, she made an excellent video, although having a bit of a go at me, for not delivering it within a few weeks, but we finally got it delivered in Acton with the vaccination centre there. And she's done a tremendous job in actually leading the vaccination communication in her community. I completely agree with her. It is abhorrent and completely wrong for anyone to intimidate people who are looking to get their vaccination, or the incredible NHS staff who are delivering it, or the volunteers, or anyone else within the system, this extraordinary mobilisation that we have experienced of the nation coming together and delivering the largest vaccination programme in history. And anything we can do to continue to protect our frontline staff, I will absolutely look at. We have a senior responsible officer actually very much embedded in the vaccination deployment team who looks at security very seriously every single day, and we will not hesitate to take action against anyone who threatens any member of staff or volunteer taking part in the vaccination programme.
Videoing. Robbie Moore.
Thank you, Mr Deputy Speaker. We cannot ignore the slight reduction in vaccine uptake over the past couple of weeks, which is in despite of the fantastic work being done across Keighley and Ilkley to deal with this, including at the Silsden Medical Practice, Keighley Central Mosque and at the Airedale Hospital, who this week are providing walk-in services for young people to get their vaccine. Will the honourable friend of mine join me in encouraging all of those who have not yet done so to take up the offer of the vaccine to prevent the transmission and help protect themselves and others?
Thank you very much, Mr Speaker. And I commend my honourable friend, the member for Keighley, for his exemplary work in taking the message out to his constituents that vaccines protect people, they protect families, they protect communities, and he's absolutely right to continue to double down on his effort, and I assure him we will do the same across the system to make sure we get, whether it's pop-ups or mobile sites or opening longer hours. We've got the Eid festival beginning tomorrow. We have a whole programme around that to get the Muslim community, one, I'd like to wish them a happy Eid Mubarak, but also to come forward and get vaccinated.
John Speller.
Thank you, Mr Deputy Speaker, and as the Minister will know, I've long campaigned for a vaccine passport to enable individuals, society and the economy to speed up the return to normality. So I very much welcome the long overdue and realistic NHS COVID pass. But how is he going to ensure take-up of the pass? And can you also tell us which venues will be included, and equally important, if any sporting, hospitality or leisure venues will be excluded?
I'm grateful for the member for Worley and his support in this area. We're looking at high-risk, large-capacity indoor venues. We're working with the industry. My colleagues in the business department, Minister Scully and others, are working with the industry at the moment to take advantage of step 4, to get those businesses back on their feet, and then, of course, to take all that learning so I can be back here at the dispatch box in September and sharing with the House how we can then sustain the industry going forward whilst we live with COVID, because we will have to transition this virus from pandemic to endemic status.
Greg Clark.
Thank you very much indeed, Mr Deputy Speaker. The now famous test and release pilot was first announced on the 29th of April. So is the lack of any results of that pilot, nearly 3 months after it started, a failure on the part of Public Health England? Or are those results being suppressed because the Minister might be concerned that NHS Test and Trace don't have the testing capacity available to make test and release available to everyone?
I'm grateful for my right honourable friend's question. I shared with the House that, to answer the earlier question, that the test and release pilot results will be available in 1 to 2 weeks at time, and when they are, we will come to the House and share them with members of this House.
Video link. Tony Lloyd.
Thank you, Mr. Deputy Speaker. Can I say to the Minister that he has proved himself to be very helpful and thoughtful in the way he's handled his brief, but can he tell us this? What research has there been into the impact of long COVID on younger children, younger people? Because, of course, in the end, if long COVID is not simply an issue for adults, but for children as well, will that impact on the way in which we assess the need for a vaccination programme for our young children?
Thank you very much, Deputy Speaker. I thank the member for Rochdale for his excellent question and for his support on the weekly MPs briefing that we deliver on a Friday. Long COVID is a serious issue amongst adults and children, and of course the JCVI look at the available evidence. I would just caveat what I say is obviously this virus has only been with us for 17 months. We've only had vaccines for the past 8 of those months. So we're learning all the time, and we've made money available, as I, in answer to a question earlier, to the health service to look at how to support, for example, GPs in diagnosing long COVID.
Video link. Sir Roger Gad.
Thank you, Mr. Deputy Speaker. In addition to holidaymakers, there are hundreds of UK citizens who want to go to France to visit family. France is a country with a much lower infection rate than the United Kingdom. There are also hundreds of UK citizens, expats, who wish to visit families in the United Kingdom. As a result of the decision taken by the Department for Health, all of those people now face exorbitant test costs and isolation when they come into the United Kingdom. The House of Commons has an excellent test system which generates a result within about 30 minutes and is reliable. Can my right honourable friend, who is the most effective of ministers, use his influence to make sure that at the very least, people coming back into the United Kingdom and having to be tested can do so at a reasonable and not a disproportionate cost?
I'm very grateful to my honourable friend, the member for North Thanet, who is always diligent in his questioning, including on the Friday calls on behalf of his constituents. He raises a really important point around both the beta variant, which is, as a precautionary measure, is a variant clearly of concern to us. It probably is the one that would give us the greatest headache in terms of vaccine escape, hence why we took those precautionary measures, and we keep that under review. The biosecurity team do that very effectively. But he raises, I think, a really important point, which is around the cost of testing, and I will certainly take away his comments and discuss this within government, including with the Secretary of State for Transport, who I know has looked at this and has talked to the those involved in the testing process to make sure that people aren't penalised by exorbitant costs of the PCR test.
Point of order, Mr. Harper.
Mr. Deputy Speaker, I listened very carefully to what the Minister said in response to the excellent question from my right honourable friend who chairs the Science and Technology Committee. The Minister said that when the information was available from the test and release pilot in the next couple of weeks, he would come back to the House straight away. You will have noticed, Mr. Deputy Speaker, as I'm sure all members will, that the House will be in recess at that point. The ministers are unable, therefore, to answer written questions or lay written ministerial statements or make oral statements. Can I therefore ask the Treasury bench, through you, Mr. Deputy Speaker, if the Minister will therefore ensure that the House is recalled to hear that evidence, because of course the decision point is on the 16th of August during the recess. This will be of interest to millions of people in our country who by that point may be self-isolating. So commitment that the Minister will return, the House will be brought back to enable ministers to be questioned on this important matter. It would be helpful if the Minister could confirm that at the dispatch box now.
He's smiling at me. I don't think he wishes to intervene, but the right honourable member is absolutely right. The House goes into recess on Thursday. It doesn't come back until the 6th of September, but it is way out of the ability of the Chair to be able to recall Parliament, but I'm absolutely certain the Treasury bench heard what he had to say and will pass that on to the appropriate people. Can I thank the Minister for his statement today, for answering 29 questions in well over an hour. Thank you very much. We'll now suspend for 3 minutes in order to sanitise the dispatch boxes. Order!